God, there's this hole in the trade tower. There was this ball of fire.
Heard an explosion, looked through my window, and I saw the first building in flames and catch the exploding debris.
As you can well imagine, everybody was taken completely by surprise that anything as dramatic and as horrendous as this would take place in America. But we, of course, immediately reacted, and I think reacted positively.
We quickly established a command center, a mini command center here in the Office of the Surgeon General, being prepared to respond to that which the Office of the Secretary may request of us.
I immediately activated our operations center, and we were up and operating within minutes after the first plane crashed into the North Tower. As soon as the plane crashed into the South Tower, I was absolutely convinced that this was a terrorist event.
People then realized this was not just a plane accident. This was an attack, and we started thinking right off what we had to do.
The entire tone at the office changed immediately. As soon as the second plane hit, we went from the curiosity of breaking news to we have a situation that we've got to start getting ready for.
It was pretty apparent that World Trade Center was going to need some services, and so we started looking to see what could we do. And our office did something quite unusual. For the very first time, we stood up every entire DMAT team that we own. We told them, get prepped, tell us who's ready to roll.
And I knew right then what I had to do in terms of emergency training that we've had, since we're the emergency support function for the federal response plan that deals with health and medical response. I went straight to the FEMA office.
We were in charge of health and medical care and public health, so we had among very close to us the New York City Department of Health, CDC, SAMHSA, and EPA, and the State Department of Health.
I had to concentrate on my task. And the task was that, we had this bright idea of putting together a triage center. We were trying to get ambulances. I wanted, the people that were standing along the side of the building obviously had come in off the street, so it was very congested inside there. We had a couple of people who were actually, by that point, quite ill. I need the staff down here, bring supplies. And I also asked that folks from the Department of Mental Health, which was just down the street, send over some social workers. And I just got to work.
We knew that despite how prepared this city is and how vast its resources are, this was going to overwhelm them somehow, and federal resources were going to be necessary.
Things were moving pretty fast and furious, and then plane number 3 came into the Pentagon. And I don't know if you remember that day, but we lost all telephone communication. And then suddenly we were like, our primary source of being able to reach people was knocked out.
Communication was really very spotty. We didn't completely lose it, not for very long. It was hard to make phone calls. It was hard to get cell phone calls out. It was hard to reach people for long periods of time. But we knew what the other people were going to be doing. They knew what we would probably be doing.
Suddenly, the building just shook, and there was just noise, like boom, real shaking of the building. I mean, and I came downstairs, and I just thought, oh my God, this is going on. This is ongoing attack, and I knew that I was going to die today. But suddenly I looked out and people were running, and whereas before it was, tens, hundreds, there were thousands of people, just like a seething mass of humanity just running up the street, followed by all kinds of particulate, like a cloud of particulates and debris and stuff flying around, and it was awful.
When the towers went down, you had a totally different scenario. when the Pentagon was hit and when the other plane crashed in Pennsylvania. Now you had the additional activity of a plane crash in Pennsylvania, which would be normally a large response for OEP anyway, 2 buildings collapsing. Huge, unprecedented scale of response was going to be required for that, and then simultaneously having to respond then to another building collapse and plane crash in D.C.
Originally, we didn't know how many injured and wounded there were, and what the capacities were going to be in the hospitals. We didn't have a real good status report on some of the downtown hospitals and what their capabilities were. So we were planning on bringing in teams to support both the local infrastructure as well as provide medical care at the site.
The local teams for New York, we moved them into place to deal with the situation in New York and to pre-stage outside of New York City. Our push package teams were going to D.C. deal with the Pentagon situation, and we were at the same time trying to mobilize a management support team with DMORD assets to be able to move immediately to the Pennsylvania site.
Our initial thinking was to have the New York City hospitals ready for a large number of casualties. That after the first 2 or 3 hours, it became evident that that was not the case, it was not needed, that the disaster was taking a different kind of a nature.
And we were waiting for like waves of casualties to be dug out, and there just sort of came this eerie point when we realized everybody must be dead. These were just people going to work.
And then the real mission emerged that we carried out here, and that was administering first aid and primary care to the workers who were digging frantically at that point. We didn't come in and respond to the injuries that we anticipated, but we found another very important role.
The attack itself was not a public health attack per se, yet the results of it had tremendous public health implications.
When the dust started to settle, and we're talking hours or days later, not instantly like it looks on TV, and when the firefighters regrouped and had some time to rest and recover, they noticed the complaints that I'm just mentioning. Tremendous eye irritation, tremendous nasal and sinus irritation, throat irritation, coughing.
So that what was happening at the World Trade Center site was that unregulated and unorganized volunteer response was taking place. That was replaced as a decision by the New York City government to use a system that was well managed, which is why they turned to the National Disaster Medical System and to our department to provide the response at the World Trade Center site.
So what the Public Health Service did was to step in and really help give the city some organized medical response.
Our main responsibilities within the Commission Corps Readiness Force are to provide very specific technical expertise in the event of a crisis or emergency, or to augment other assets that are going out the door. We provided officers in experts in numbers of 1 to full medical teams in numbers of 40. We supported medical missions, we supported public health missions, we supported environmental missions. We had officers across every category, across every agency, across every grade, every level of experience and training going out the door.
We would be sending a 43-person team. They had a very specific mix that they wanted in terms of, they wanted, for example, at least 4 physicians. They wanted at least, I think, somewhere between 5 and 7 mid-level individuals. Then they wanted a complement of nurses and EMTs. They wanted pharmacists.
The fact that we had physicians, EMS, and later the federal health professionals on the scene was a tremendous benefit, because the firefighters' goal, the city's goal, was to have these heroes continue to operate. We felt that many could still be saved. And you don't want your first responders, your rescuers having to leave the scene to get medical attention.
They knew these people weren't going to leave. And the big effort they wanted to make was keeping them as healthy as they could while they went back to work on that pile.
We were able to move medical units into each of those quadrants and make them visible. And where they weren't entirely visible, we were able to put up just makeshift signs directing people to where they could get respirators, where they could get medical care. And in tracking the numbers on an hourly basis, which we were doing throughout, we were able to see a marked increase in the number of patient contacts.
We want to be able to provide the expertise that's being needed within a specific response. And in many cases, it's not sufficient to simply provide a nurse or a physician or an engineer. It requires that you provide the right nurse, the right physician, the right engineer, people who are going to be capable of going out and being able to deal with a very unique, very difficult situation of being at ground zero for 2 weeks in very austere conditions. I mean, there's some just amazing, amazing stories that came from ground zero that I could never do justice to.
Our first shift was the night shift. People just standing on the side of the road with signs, banners, screaming, "You are our hero," you know, "Go, go, go, USA." I mean, we went from kidding around innocent banner to everybody just like, this is real. And when we got there, and we're walked out to the ground zero, you know, being late at night with the lights and the shadows was, I think, made it even more eerie than seeing it, you know, in the light of day. It was frightening to see.
The very first day was hard. It was very hard. It was easier to look at the people than it was to look at the buildings and the absence of the buildings. It was harder for me to look at what was left because I felt like there were so many voices and feelings and personalities attached to that rubble.
I remember seeing smoke. I remember seeing a huge pile of rubble. I felt like I was in the middle of a war zone. I've never been in one, but that was the impact that I felt.
I mean, the sounds of the crane, I won't ever forget that. And you could just always hear it because it was right outside that clinic, and it was a screeching sound. It really was almost as if, you know, the buildings were crying.
When we got to ground zero, immediately you can smell, you can feel, taste how bad the air quality was.
This is really heavy-duty rescue recovery in a construction-like atmosphere. The only similarities would be a war zone, an earthquake, a volcano. So you're dealing with a lot of rubble and people having to move very rapidly to find people that might be injured, that might be still recoverable.
We were seeing a lot of foot injuries, ankle injuries where they would step off of something, hand injuries and blisters. Another major thing that we saw that most of the men seemed to have was tremendous chapped lips. It doesn't sound very bad, but it was a signal to us that, one, they weren't hydrated well, two, it was overly hot in there, and they were just searing off. And we knew if we didn't take care of just some of the basic things like that, it would get worse. They would get infections, they would get open sores.
You know, they needed to keep themselves healthy, and that working long hours might not be the best they can do, because once they burn out, we start losing numbers. They need to be hydrated. Educated them about hygiene, you know, changing of socks, keeping your feet dry.
One of the things we tried to do is make sure that there were adequate number of respirators for rescue workers. We decided to also have replacement cartridges and respirators also at the clinics.
My role was to be a mid-level provider, so that would be a nurse practitioner, managing injuries, burns, for example, to providing, simple care, blister care management for these folks who have been on their feet for hours.
Well, as a pharmacist, my main responsibilities was to assure that we had appropriate supplies and et cetera. But everybody on the team is trained as a first responder, so we can jump in and help out with whatever is necessary.
You know, we saw a guy, his leg was broken, and he's still trying to go out on the pad to help, you know, dig people out, to do whatever he could. And meanwhile, you see him like, you know, he can't even walk on his leg, but he wants to go back out and help. And we're like, wait a minute, you need to come see us. Please come see us, because if your leg is broken and you continue to walk on it, you're going to make your injury worse than what it is.
The first 2 days, the best thing I think I felt like I did medically was pull out a cot. They would lay down, and within a minute they were sound asleep. I mean, just completely asleep. They weren't coming in for Band-Aids. They weren't coming in for Kleenex. They weren't coming in for anything else, but they would see that cot and they would get an hour sleep, and by their look you'd think it would be a day, but within 1 hour they knew it was time for them to go back.
Talk to them. Make sure you talk to them. Make sure you just ask them how they're doing. They may, you know, open up to you. It's just so important just to talk to them.
They oftentimes have that kind of faraway look in their eye. They often maybe, just want to go and sit in a corner. And as I would get them to talk, then over time, as maybe we stood there 15, 20 minutes, maybe longer, conversation would lead from one thing to another to another.
There was a man who looked like he was a steel worker, an iron worker, and he said, "I'm just looking for my brother, I'm just looking for my brother." And I said, "Well, what is his name?" And he told me his name. And there were two lists. There was one list of just their names, and then there was another list with their picture and their name below it. And he said, "Oh, there's his name." And he said, "I just have to find my brother's picture, and I just have to do it. I just have to do it." And so I saw the picture, but I kind of thought, well, I'm just gonna wait until he finds it. Again, not really knowing why, but I thought I'd just be there to support him. He turned to me and he said, that's my brother." And I thought, how could you, that was his real brother. And I can't, at that point I thought, how could you be, you're out here, you're trying to help do your duty, at the same time you're struggling because you're looking for your brother in all this rubble. And I just had so much respect for him. I just, I hugged him, and I thought that was part of my job, was to help folks deal with all the emotions of being at this disaster.
The medical examiner needed dentists to assist in the forensics portion of what they were trying to do in identifying these thousands of body parts and victims, and we were able to provide 15. Again, we went back to our membership and we found people that had already had the specialized training that they needed.
That aspect of dentistry is handled for the most part with the armed forces and DMORT. And so to be deployed in this type of mission is pretty unusual.
Previous to all the advancements of DNA, dental identification was the only scientific way to verify who you were trying to identify.
Well, most of what we saw were not intact bodies. Most of it was parts and pieces, I guess you would say. Sections of a mandible or a couple teeth, various bones of the jaw, and so it was kind of our job just to, identify them, examine them, x-ray them to the best we could with what we had to work with, because basically all of our work was to give them closure, and so it was a very emotional subject in that matter.
The Office of Emergency Preparedness, particularly through our Disaster Mortuary Operational Response Teams, the DMORTs, we have an agreement with National Transportation Safety Board, with NTSB, to support them during major plane crashes.
When we arrived in Somerset, they gave us a couple choices of where we were going to set up the morgue. So we first looked at our options and then started making plans to start doing our job.
I was assigned to work as a mental health person for that team, as well as to the what we call the Disaster Mortuary Operations Response Team, the DMORT team. So it was quite an experience because I have never done that before, like many of us who helped out. And at that point in time, I realized that it was a very important job to do and why mental health was needed, because many of us were seeing things we had never seen before.
I was there and the MST was there to support the mortuary officers. They had about a total of around 40 mortuary people that were processing remains from the crash. Plus we also had a family assistance personnel there too, working with the families, doing DNA blood draws.
In order for us to help identify remains, we need to ask pertinent questions. So I was asked to sit in some of the interviews while family members were asked very specific questions of their loved ones. And it's important that we inform the individuals, the family members, that they may have a depression set in, stress will build up 2 to 3 months after the fact, and it's important that they seek some kind of counseling.
When the first anthrax case hit down in Florida, it was just like somebody punched me in the stomach.
In Florida, we started with a single isolated inhalational case. That means something very, very unique. In New York City, we started with a single cutaneous case. Is there aerosol risk for inhalational disease or not? And then in Washington, with the delivery of a contaminated letter to Senator Daschle's office that was opened, we faced yet a third scenario where instead of starting with clinical disease, you're starting with an exposure event, a defined exposure event to a known contaminated letter.
We actually went into the Hart building. We were a floor below where the Daschle letter was opened, and they needed us to be able to do a number of things. First off, to take care of the people that were primarily exposed, and I probably swabbed more noses in that 1 week than I've done in my entire nursing career. But it wasn't just collecting a sample. People were scared. We needed to talk to them. We needed to explain what their risks were. We needed to talk to them about the drugs that we were offering and make sure that they understood both the risks and the benefits of taking the medication.
So if you worked in X office or had been in that office for a certain amount of time on particular days, you were part of the risk group and were given the prophylactic antibiotics, initially at that time for 60 days. And other people who were not part of that group were given antibiotics as well, but it was a prophylaxis that was given for only 3 days, and then it was extended to 5 days until test results from the mass nasal swabbing came back to where the team could decide who and what groups were at risk.
None of us had ever responded to something like this, a mass prophylaxis campaign where we had to give out medications to tens of thousands of people. And it allowed us to learn. From the first day at the Capitol, with it being chaotic, we still got the job done and people got very good care, but it was still, it wasn't the ideal situation. And even just by the next day, we had written information in front of us. We had the flow down. We had all the information we needed. The following week when we were at DC General, it even got better. We had a bigger facility. We had people in place to talk with the media.
But probably the biggest contribution that we were able to do in that entire event was to put out excellent public information.
The other investment that was large and but turned out to be very important was the National Pharmaceutical Stockpile. It basically performed without ever missing a beat. Even as the investigation unfolded and became enormously complex, they were able to move people, materials, specimens, antibiotics, vaccine, to everywhere it needed to be, at the time it needed to be there.
But I think if people wouldn't have reacted and responded as quickly, we maybe would have seen more deaths, a lot more deaths.
The investment in the laboratory response network for bioterrorism at a national level was fabulous. I don't know what we would have done without that capacity. If you can imagine the confusion that would have resulted had we not had standard validated methods and reagents available at widely distributed laboratories within the public health system, it would have been a catastrophe.
The federal government has a reputation of not working well with each other, the various departments. But in this case, there wasn't any turf battles whatsoever. Everybody rolled up their sleeves and said, we have a national disaster here. We're under attack by, we don't know by whom or by what, and we don't know what the next attack is going to be. So let's do our job properly.
Absolutely no doubt in my mind that because of the activities of the Commissioned Corps Readiness Force and the National Disaster Medical System, we were saving lives.
We are not over the threat. We are simply in a pause. We have a responsibility as a nation and as a government to use that pause to take the lessons learned and to prepare ourselves for what we can anticipate will be another phase.
Pandora is out of the box in this regard, and we are going to have to maintain a much higher level of preparedness and capacity to respond to these events than we have in the past.
Planning needs to continue for different types of scenarios, different weapons of mass destruction. Biologicals are one, but chemicals are another, like sarin that happened in Japan.
And I think people will look to us to come out and help. You have the Homeland Security now, which the Commissioned Corps is a part of, and all kind of disaster preparedness plans are being put in place. So I think we'll be more than ready.
We trained about 100 folks to work in a bioterrorism type of an event, and we plan on continuing to have more of those classes in the future. Our piece is we want people to know how to first take care of themselves so that they can then take care of their families and their patients. And we're working in that direction right now.
As individuals we might have limitations, but as a group I think we cover each other. And I think there was not a moment at all that I ever felt that we would not be able to handle what was thrown at us.
Not having the Commissioned Corps of the Public Health Service available, I think, would have slowed down the response that this department would have had, would have made it more difficult for us to mobilize and to get to where we needed to be as a department, as one department, with one message, with one mission. And the Commissioned Corps, I think, really showed what it really could do.
When they identified 4 people to go out and throw that first pitch, they had a cop, they had a fireman, they had a Port Authority police officer, and they had a member of NDMS. Those were the 4 people that New York identified as the people they wanted to represent them. And I pointed to that picture, I said, that's why we're putting up with everything you're doing here. That's why you're coming in here, you're working these hours. That's why you're doing it. You're doing it because the people in New York feel like what we're doing is one of the 4 most important people they have there. You're supporting their heroes.